Вот, начать демонстрацию. Получилось. Еще раз. Переключить экран. Не переключается. Ага. Вот. Переключить экран. Can you see the screen?
Yes.
Thank you. Вижу. Куда это делся? Так, вот это убираем. Раз. Пока слайдов. И сюда. Не получилось. Так. Вот. Сначала. Ага. Так, ну вот. Now it's time to begin the lecture. You know that this lecture devoted to cellular components of inflammation. This is phagocytosis and all events which are during phagocytosis. You investigate this in the previous course. And now I try to tell you some more new information. Now, at first, this is the stages of leukocyte emigration. Now, you know that there is a question in colloquium. Name the stages of leukocyte emigration. This is the stages. The first is margination, means the leukocyte will come out from middle part of bloodstream to periphery. This is the second picture. Next will be rolling. Next, adhesion, then diapidesis, comes leukocyte will comes through the gap between endothelial cells, and then transmigration when leukocyte comes to the region where the hemoattractants concentration is highest. This is, again, this is margination, then rolling. When there appears rolling, when there is not closer contact between adhesion molecules on the membrane of leukocyte and endothelial cells. Then adhesion, there appears the endothelial cell secretes the adhesion molecules, which has the closer contact with integrin, which appears on the surface of endothelial cell. And then diapidesis, you see the neutrophil comes through the wall vessels, and then transmigration. The leukocyte comes to hemoattractants. This is a graph which shows you the black line. You understand, I think you remember. This is the stages of increased permeability. And the color, red and the bluish color, is the time period when the leukocyte comes out from the vessels into interstitial space. And you see that neutrophil begin to comes out from the vessels during venous hyperemia. After 2 hours after injury. Why it begin to comes out? You remember that immediately after injury, during or after, this is effect of axon reflex. This is the granulation of mast cells, and mast cell secretes chemotactic factors for neutrophils. Except these chemotactic factors, maybe in the zone of inflammation appears bacteria, maybe, or any other injurious agent which can attract neutrophils. So neutrophil begin to comes out from the vessels into interstitial space. The maximal number of neutrophils in the zone of inflammation is from 4 to 6 hours. But after 1 day and the second day from the injury, the number of neutrophils begin decreases, and a little up to 2 days, the neutrophils number decreases up to normal. And as for monocytes, due to this graph, you see, increase their numbers when there is decreases neutrophils number. Why? Because remnants of neutrophils and dead neutrophils is the hemoattractants for monocytes. And the number of monocytes in zone of inflammation increases in 10 times higher than its concentration in healthy person, in blood. And these high number of monocytes stay up to the end of inflammation, means approximately 10 or 7 days. You know that Mechnikov is the Russian investigator who pay his attention to phagocytosis. And that is why appears Mechnikov's law. This is the order of leukocyte, which migration through wall vessels in the region of inflammation. And this law is neutrophils, the first, monocytes, and the last will be lymphocytes or eosinophils. It depends on the cause of inflammation. This picture shows you a very interesting correlation between the events which are there in the zone of inflammation. The first is increased number of neutrophils, and you see there is maximal 1 day, and after the second day the number of neutrophil decreases. When neutrophil number decreases, monocytes increase their number, and you see it will be more numerous up to 6-7 days. This is the time period of acute inflammation. Next will be fibroblast, left lower corner. You know that the wound in acute inflammation will be restored from periphery to center of this wound. And the main cell which take part in restoration is fibroblast. And you see, compare this is the 6-day maximal number of fibroblasts in the zone of inflammation. This is end of the acute inflammation. And you must remember that monocytes or macrophage it comes at the end of acute inflammation to clean the zone of inflammation from dead neutrophils, remnants of neutrophils, remnants of dead surrounded cells, connective tissue, and dead bacteria or any other injurious agent which monocytes can phagocyte and remove from. Monocyte has enzyme as proteases, and the type of proteases is collagenase. Collagenase, due to its name, can break down of collagen, and that is why collagenase will break down the scar which can form fibroblasts. From one hand. From the other hand, collagenase is the growth factor for fibroblast growing or proliferation and capillary growing, you see, to the region of inflammation. And you see on the right lower corner there is capillary, the green line, and there is the collagen. Means sometimes there may appear the scar in the zone of inflammation. Now, this is again the stages of phagocytosis. You see, there is monocyte due to the Monocyte or monocyte, I think. No, it is segmented nuclear, means there is neutrophils in the middle of the lumen of the vessels, you see? Then there appears margination. These neutrophils come to periphery. No, they meet the rolling effect and show you the adhesion of neutrophils. Then there is the epidesis, when these neutrophils comes through the wall vessels. You see, you must pay attention that the adhesion of neutrophils or monocytes on the wall vessels may lead up to hours, you see, but the epidesis means comes through the wall vessels from 2 up to 12 minutes. And you see here, they show you that neutrophil cannot damage endothelial cells. It comes through the gaps between endothelial cells. And you know, neutrophil has a lot of granules. That is why in some of granules there are proteinase. And this enzyme will break down the basal membrane and further come through smooth muscles. That is why there is not injury of wall vessels. The mechanism of rolling effect and adhesion leukocyte on the wall vessels appears on the membrane of leukocyte and endothelial cells, adhesion molecules. Adhesion molecules, they are proteins. First, this one. This is family of adhesion molecules. Selectin, you see, integrin, and more complex is ICAM or VCAM. ICAM means intracellular adhesion molecules. What this one, you see, adhesion molecules is are proteins, you see, and its function is receptor. You see, this red arc is the plasma membrane. So this short domain comes inside the cell. These long domain belong to outcellular part of adhesion molecules. You see? And the function of adhesion molecules is to make a contact from cell to cell or from cell to the matrix, mean to outside of the cell. Return back. This one, which there are 3 families of adhesion molecules. The first is selectins, LEP. Next, integrins and immunoglobulins family. I told you ICAM and VCAM. As for L-selectin, these adhesion molecules can be expressed on the surface of leukocyte, and the same did integrins. How can it appears? Now you see that in neutrophils there are a lot of granules. In some granula, on the inner part of these granules, on the membrane of these granules, locates these molecules, selectins and integrins. When neutrophil is activated by hemoattractants, this granule comes closer to plasma membrane, binds to it, open and binds to it, and these adhesion molecules, selectin and integrins, appears on the surface of neutrophils. That is why the adhesion molecules on neutrophils appears very early, and it cannot give the contact because with endothelial cells, because endothelial cells has not granules, and it must secrete the synthesized the selectins, and P-selectin must be synthesized inside the endothelial cell, and after the activation of and retraction of endothelial cells, it appears on the surface. As for adhesion molecules, complex adhesion molecules of ICAM, it appears after 2 hours after the beginning of injury, because endothelial cells must synthesize them, the same as leukocyte. Now, this is again about the stages of phagocytosis, of emigration. You see, that is the first. You see, what this is due to nuclear, segmented nuclear. This is neutrophil. On neutrophil appears L-selectin. L-selectin will bind to its own receptors, but the contact is weaker. This is the first cause for rolling. And another one, it is the velocity of blood flow is higher than normal, and that is why the neutrophil begin to turn around themselves. It appears a rolling effect. And if you remember the beginning emigration of neutrophils after 2 hours after injury, you see, this is the time period of venous hyperemia, and during venous hyperemia there is decreased blood flow velocity, and you see there is adhesion. This one, look, you see there is rolling, the first, means integrins, and E-selectins has a very weak contact, but the last picture shows you that integrins binds to ICAM and VCAM, and it will catch the neutrophils and stronger connection. You see? So there appears the adhesion of neutrophils. Посмотрели? This one. No, the picture which shows you why there appears rolling and absent of close contact, and another when there is the close contact. You see, upper picture show you the blood vessel. Inside there is a macrophage, activated macrophage. You see, there is the second and third macrophage, which is in condition of rolling. You see? Next is the membrane of this macrophage. No, monocyte, as it is in vessel. Membrane of monocyte, in which appears the adhesion molecules, different types. You see, below is the membrane of endothelial cells. You see, this red is L-selectin. You see, this L-selectin and cannot bind with P-selectin or any other adhesion molecules. You see, and before adhesion, there appears integrins. You see, this is integrins, the stem with a bubble on the end of. And on the endothelial cells begin to synthesize the ICAM, you see, or any other. And that is why it begins adhesion. When you see the hook from the ICAM or VCAM that binds to this bubble on the end of integrins. Well, that is why there appears the closer contact, you see, between these adhesion molecules. Now, this graph shows you what is the time period of leaving these adhesion molecules. Now you see the ICAM stay on the endothelial cells up to 5 days. You see, selectins living time is very short. The question is, what is the role of adhesion molecules? Now, you understand that there are hereditary disease during which there appears the deficiency of leukocyte adhesion molecules. It may be two types of leukocyte adhesion molecules. At first, on neutrophils, there are absent or decreases the integrin adhesion molecules. And another type, there will be the deficiency of neutrophil ligands, means on endothelial cells there is absent or decreased synthesis of ICAM or VCAM. And what will be if there is the deficit of adhesion molecules? No, and there is the questions in colloquium. What is the complication in the situation when there is a deficit of or deficiency of adhesion molecules? And opposite, what will be the in patient if there is excessive synthesis of adhesion molecules? Now you see, if there is deficit of adhesion molecules, you understand that the neutrophils and monocytes cannot come out in the region of inflammation. If that's so, there appears what? Chronic inflammation. And the opposite situation, if there is excessive synthesis and express of adhesion molecules, more leukocyte in one time comes out from the vessels into interstitial space. And this will lead to very severe inflammation. This will lead to increased zone of inflammation. Hemokines, you see, no, there is absent the questions in colloquium devoted to hemokines, but you must know that this is the chemicals which help to leukocyte to comes out from the vessels, help to leukocyte and endothelial cells to form, to synthesize adhesion molecules, and and work as hemoattractant. This is hemokines. Hemokines has its own receptors on the plasma membrane, and this receptor is bound with G protein. And this is the function of hemokines, and I will show you the picture. You see, look, hemokines here is as a green circle. No, at first, the first picture, neutrophils, you see, and these hemokines influence on endothelial cells and stimulate endothelial cells to express adhesion molecules such as ICAM. You see the second picture when neutrophil binds to endothelial cells. There is adhesion of, you see. Then next is the hemokines help to neutrophil to comes out through the endothelial cells in the region of in the interstitial space. And you see out of the vessels there are very many green circles. They are hemoattractant, and that is why it will help neutrophil to positive hemotaxis, means the it will move straight to bacteria. You see? No, this is the different types of chemokines for different cells, and approximately the main effect is chemoattractants. No, for example, MCP1, the first chemokine, named as macrophage chemotactic protein. No? And all the other, you can understand what is this. Next, so at first, there will be the stages of emigration of leukocyte. Then, when there will be diapedesis and of leukocyte, and then leukocyte comes to hemotactic factors, there appears the phagocytosis. So this is the stages of phagocytosis. Now, at first, the neutrophil, the same as monocyte and eosinophils, they are obligated phagocytes. So they can recognize the target agent and approach to them. So mechanism of this stage is positive hemotaxis, and this is the question in colloquium. What does it mean, positive hemotaxis? Means the moves of leukocytes straight to the region where hemotactic factors concentration is the highest. Next stage is of phagocytosis is adherence to pathogens, to these target agents. You see, the mechanism of it is opsonization. What is this? I explain further. Next, engulfment of these injurious agent, then form phagosoma, and after fusion with lysosome, phagolysosoma. Mechanism of these is opsonization too. And the last stage of phagocytosis is destruction of target agent by lysosomal enzymes. Before destruction, there must be the killing by the injurious agent, the bacteria, by those enzymes. And further, there will be destruction by hydrolysis. Now, as I told you, obligated phagocytes, neutrophils, macrophages, and eosinophils. This is chemoattractants for neutrophils and for macrophages or monocytes. You understand? This is another course which shows you why neutrophils comes first in the region of inflammation. Because not only it is easier for neutrophil comes through wall vessels, through the very small hole gaps between endothelial cells. Due to neutrophil has segmented nuclei. And another, there are very many hemotactic factors for neutrophils. You see, compare with monocytes. This is the second. And the third, neutrophils has it's granulated cell, so it has very many enzymes for killing and for destroying the target injurious agent. Now, this is again about the picture, about the phagocyte stages of phagocytosis. What the number one? No, you see, this is phagocyte, and the picture below, the first show you that target agent is bacteria. And you see, I told you that there must be opsonization. You know that there are two types of opsonins. At first, the role of opsonin play immunoglobulins G and M. And another opsonin is a fragment of complement C3b. Look, on the surface of leukocyte, there are receptors for C3b, the first and the second. There are receptors for Fc fragment of immunoglobulins. That is why, you see, immunoglobulins with its Fab fragment binds to bacteria, and its Fc fragment is free and binds to its own receptors on the surface of neutrophils. That is why it will help with the help of pseudopodia, surrounded these bacteria and form phagosoma. What the second is, engulfment of these bacteria and form phagosoma. So in your colloquium, there is a question. What does it mean, phagosoma? How can you give the definition or explanation? Or you may write down that phagosoma is the sac formed by plasma membrane of phagocytes with injurious agent locates inside of phagosoma. Don't make the mistakes and told that phagosoma is vacuole. No, vacuole, the membrane to vacuole appears from Golgi complex, you see. As for phagosoma, its membrane is the membrane from plasma membrane from neutrophils. And that is why there are some receptors which normally is outside the cells, appears inside of phagosoma. Now, this is a picture which shows you when and how can macrophage engulf the old erythrocyte. You see that macrophage is the single cell in our organism which can recognize any other cells that are ready to die. And that is why before it, macrophage will engulf them. Now you see, this is the white oval is erythrocyte, red blood cells. You see, значит, attachment to red blood cells, then right upper corner, the macrophage begin to release pseudopodia which surrounded red blood cells. You see, begin to engulfment, and the right lower part, you see, some of these red blood cells is appears inside of macrophage. But that is why there is some words about neutrophils. Now, I think you all remember such word that neutrophil is the first line of our defense. Now, you see, there are very many granules in neutrophils, and in these granules there are a lot of any other enzymes, you see. And look, there is not only enzymes but receptors for hemoattractant, receptors for complement fragments. Very interesting. And one of the main enzymes for killing injurious agent is myeloperoxidase. You see? What this is the processes which appears in phagolysosome. You see, there are two, at first these injurious agent, in this case there is bacteria, must be killed by, and there will be irreversible injury by free radicals. And these free radicals appears under the influence of myeloperoxidase, you see, and not only about this, but there are on the plasma membrane of neutrophils and monocytes appears such enzyme as NADPH oxidase, NADPH, nicotine amide dinucleotide phosphate. And this enzyme has two centers. From outside is oxygen center, and inside the cell is the center for transporter of hydrogen. And you see here nicotinamide dinucleotide phosphate, you see, appears when restored. These transporter gives the hydrogen, gives the electron to oxygen, and this form the free radical, you see. So there is such term as bacterial system of leukocyte. Bacterial system means the system with the help of which the bacteria or any other infection must be killed by enzymes which appears in phagosoma. No, they divide into binds with oxygen or without oxygen. Now, let's look their function. This is, if it is in its content is oxygen, means there appears free radicals written back. What you see, there may be superoxide free radical, there will be hydroxyl free radical. You see what there is the enzymes with the help neutrophil kills bacteria. So they are lysozyme. You see, it can destroy bacterial wall. Then lactoferrin, it can bind to the iron in respiratory chain of bacteria, and that is why this will lead to stoppage of cellular breathing. Then cation proteins. Now, cation proteins is amphiphilic chemicals, and that is why it will bind to wall membrane and change their construction, and that is why this will lead to make the pores in it, and that is why there will be lead to the injury of bacteria. Now, about the myeloid peroxidase, I told you. And this is the function of neutrophils. Again, I hope you remember it. Neutrophils are the first line of our defense. Because neutrophils are the first which comes in the zone of inflammation. Next, neutrophils arrive first, and this is the several causes. At first, there will be easier for neutrophils to come through the wall vessels when the hole between endothelial cells are small. The first. The second, there are very many hemotactic factors for neutrophils that we saw it. And neutrophils has in its granules very many enzymes for killing the injurious factors. And another one, neutrophils are the mature cells. You see, mature cells. And that is why it cannot use the energy for become mature, as for example monocyte can do. No, and this is about monocytes. When monocyte comes out from the vessels, we name it macrophage. Значит, at first, macrophages take part in acute and chronic inflammation. Macrophages comes in the zone of inflammation after neutrophils. Why? Because it can clean the zone of inflammation from the remnants of neutrophils, from dead neutrophils, from bacteria, you see, because macrophage has not granules, and it has only lysosome with hydrolysis enzymes. You see? Another one, macrophage or macrophages are antigen-presenting cells. That is why when macrophages clean the zone of inflammation, it will cut the infectious agent, and it can find out in these remnants the foreign part of these infections, means it can find the abnormal order of amino acids in these infectious agent. You see, this abnormal order of amino acid chain is will be expressed by macrophages on its surface, on its molecules of main histocompatibility complex, and comes in these conditions, macrophage comes to the nearest lymphatic node where there are T cells, and then will activate T cells. So macrophage will initiate the immune system, response. Now this is, you see, the first picture is macrophage, but it is not activated. With the last macrophage, look, there are very many villi on its surface. You see? And activated, no, here you see the same chemokines there, and activated macrophage can secrete growth factor for fibroblast. You see, and you know, this will finish the inflammation. It can secrete free radicals because it has not oxidase, but the number of free radicals in the forms by macrophage is not numerous. As for cytokines, you see very many cytokines, interleukin 1, 6, and tumor necrosis factor alpha. They are cytokines which are the main mediators of acute phase response. Means, in other words, systemic inflammation. And some words about the eosinophils. And you see that you have the case which we will try to discuss in class, and you will receive it in colloquium and further on exam. So you know that eosinophils are granulated cells. If that's so, it has myeloperoxidase in its granules. Except myeloperoxidase, eosinophil has the magic basic protein. You see, eosinophilic cation proteins. Eosinophilic, the protein which are toxic to neurons, you see, and all of these chemicals are toxic to parasites. That is why, no, this is the first. The second, eosinophil has receptors for immunoglobulin E, and eosinophils are the target cells for immunoglobulin E, and that is why it will take part in allergic reactions. Eosinophils, the same as neutrophils, can produce free radicals, you see? And that is why, no, I told you, because it has myeloperoxidase. And another one, eosinophils have not bad mediators, which can release after allergic reaction, but good mediators. No. Good mediators, for example, histaminase, which can break down of histamine, and the time period of allergic reaction decreases. This is one of the example of good mediators. But this is the role of eosinophils. Now about the immune reaction and allergic reaction, you will discuss in immunopathology. But we have the case about another role of eosinophils during helminthosis. You see? Yeah. And what this is the picture which shows you this. Look, you see in organism appears parasite. You see? Can you see it? Yes, worm. And this parasite covered by cuticula. This cuticula has its own protein, and this protein is foreigner for our organism. It can be found by macrophages, you see, and macrophage, as I told you, will activate immune system, and information will come to B lymphocyte, B cell. B cell will turn into plasma cell. No, they mix this, and number one show you B cell, which can be secreted immunoglobulins. Immunoglobulins appears, you see, here. And these immunoglobulins can bind to Fc receptors on the mast cells. Next, this one, number 3. in the circle. This is the muscles, and after they form the contact antigen, this is the antibody, this will lead to degranulation of mast cell. So mast cell degranulate, and there appears all these 5 enzymes or mediators which release from the granules of mast cell. They are histamine, heparin, proteases, hemotactic factors for neutrophils and eosinophils. And you see there in the region of where these parasite locates, there appears hemotactic factors for eosinophils. And look, it will attract eosinophils to come from the lumen of the vessels to interstitial space. Further, these eosinophils will come to the region where there is a parasite locates. And you see there appears immunoglobulin, you see, it is, and C3b receptors are there, and immunoglobulin G, which works as opsonins. So eosinophil binds to its own receptor, but you see the parasite, is too large. The size of these parasite is in several times larger than eosinophil is. That is why it will be absent to phagocyte. No, but eosinophil can release their mediators, which are in its granules, and these mediators damage the cuticulus and further, as you see on the picture, the membrane of these parasites. Now, that is why this will lead to the kill of these parasites. Is it clear? This is one of the example of uncompleted phagocytosis. But you see, there are hereditary diseases during which appears if there appears the defect in phagocytosis due to the defects in membrane in the function of macrophages as usual, and neutrophils too. At first, if there appears defect in opsonization, so there will be what? If there is the defect in complement system, so there will be absent as C3b as opsonin. That is why there appears some disease, for example, as sickle cell anemia has these defects in macrophages. Another one, engulfment. So, these appears in such disease as there will be leukemia or aplastic anemia, you see. And another one, you know, some bacteria cannot be killed inside the phagosoma. No, at first there may be the problem with formation of phagosoma, the first. The second, there will be absence of myeloperoxidase and any other killing enzyme, and that is why there will be the bacteria stay in phagosoma and proliferate there, you see. And that is why this may lead to, at first, chronic inflammation, you see. For example, the tuberculosis bacteria will stay inside the phagosoma. And in colloquium, you have such question about the uncompleted phagocytosis. I gave you one example of uncompleted phagocytosis. You see, if the phagocytic agent is in size, is larger than neutrophils, macrophage, or eosinophils, phagocyte can degranulate and release their enzymes to outside. So this will lead to damage the target agent and at the same time the surrounding tissue. That is why this will lead to increased zone of inflammation. Another one, if there appears the problem to form phagolysosome, and that is why there appears the not enzymes inside of phagosoma. That is why the bacteria cannot be killed. Another one, I told you, not all microorganisms must be killed inside of phagolysosome. I told you that this is about tubercular bacilla, you see, and this will lead to chronic inflammation. This way. Yeah. No, I told you that macrophage will activated macrophage in the zone of inflammation must be synthesized such cytokines as interleukin-1, interleukin-6, and tumor necrosis factor. These cytokines are pro-inflammatory, you see. But you see, there are two cytokines, interleukin-4 and interleukin-10, which play a role as anti-inflammatory cytokines. No, that is why you see they will inhibit the secrets the pro-inflammatory cytokines, and that is why they will used in treatment of severe inflammation. No, except here on the left, you see these cytokines production pro-inflammatory is decreased after the influence of interleukin-4. It may be secreted by B lymphocyte. As for interleukin-10, it will be secreted not only by B lymphocyte, but T lymphocyte, macrophages, and monocytes. You see? And some words about chronic inflammation. I think I told you on the previous lecture a little bit. No, repeated. So, the causes which can, no, this is, you understand, this is the questions in your colloquium. You see, what is the causes which lead to appears the chronic inflammation? No, it means that this is persistence of infections. What does it mean? Means the same of infections appears in organism several times and you see for prolonged time, and that is why the immunity of this patient is decreased, and this will lead to intensive proliferation of these bacteria. So, as usual, as the patient has autoimmune disease, all autoimmune and immune disease ended by inflammation. And if there is autoimmune disease, as usual, this is the this patient has chronic inflammation. No, another one, if the treatment of acute inflammation is not successful and the same infectious agent influence again, so this will lead to chronic inflammation. And incomplete phagocytosis, as I told you. This is the mechanism of chronic inflammation. No, I told you unsuccessfully acute inflammation response means there will be not appears the cytokines interleukin-4, interleukin-10, but appears the pro-inflammatory cytokines which lead to acute phase response. So this may lead to the chronic inflammation. And defects of macrophages, as I showed you previously, lead to incompleted phagocytosis, and this may lead to chronic inflammation. If there is appears chronic inflammation, there are some cells change their function and change their morphological state. For example, some macrophage differentiate into epithelioid cells. So this cell will be larger than macrophage, and it lost their capacity to phagocytosis, but it can reabsorb some small particles, but it cannot move the epithelioid cells, you see. The other macrophages fuse into multinucleated giant cells. These cells will be active phagocytes. No? And you see, they will form the granulomatose inflammation. Now, granulomatose inflammation is a form of chronic inflammation. The content of granuloma, because you have the case where they described you the situation, and you must understand what is the form of inflammation. So there will be activated macrophages, which is surrounded by lymphocytes, fibroblasts, and inside of it there is multinuclear giant cells and epithelioid cells. Well, this is the content of granuloma. In which disease you can find granuloma? Granuloma appears in tuberculosis, lepra, syphilis, and brucellosis. Now, we have a case about the patient with tuberculosis. Now, this is a picture of granuloma. You see, in the center of granuloma, there is necrotic zone. Then there appears, they're surrounded by lymphocyte. But look, this is look like cylinder cell. This is epithelioid cells, yeah? And there appears the giant cells here, yeah? One very large cell. You see this pink one with color. What? No, this is again about the formation of granuloma. Пропустим. No, this is again. This is the picture of granuloma, which you find there. But look, there are many multinucleated cells. Now you understand when it appears. You see, this is appears when some macrophages binds to each other. That is why appears the large cells. Inside there are several nuclei. Yeah, and this is very important information for you because for what we investigate the inflammation. We must know how to treat this disease. Now, at first, anti-inflammatory drugs. No, at first, analgesics, you see, will decrease pain sensation. Non-steroidal anti-inflammatory drugs, you see, no, type is aspirin, which decreased the lip oxygenase, and this will lead to decreased formation of prostaglandins and thromboxans. And no, any other. Then there will be glucocorticoids. This is steroid anti-inflammatory drugs. But let's look this one. It is very important, and this is the question in your colloquium. Name the anti-inflammatory effect of glucocorticoids. So, no, this you know. Glucocorticoid inhibits phospholipase A2. The effect will be decreased secretion of metabolic of arachidonic acids. They are prostaglandins, leukotrienes, and thromboxane. Glucocorticoids increased activity of histaminase. The result will be decreased living time of histamine. Means there will be decreased all effects of histamine, decreased vascular permeability, decreased pain sensation, decreased the hypersecretion of mucin, and so on. Another one, decreased activity of hyaluronidase. Now, at first, this is hyaluronidase, locates in plasma membrane, locates in basal membrane. That is why, if this activity of this enzyme is decreased, this will lead to make the membrane very hard. You see? And the complication of it will be decreased permeability, decreased phagocytosis, decreased degranulation of mast cells, you see? And that is why this will lead to decreases very many clinical symptoms of inflammation. And the last is glucocorticoids decreased protein synthesis. The complication of it will be disappeared or decreased the mediator of inflammation, which has the protein nature. They will be, for example, a complement system, substance P, neuro proteins, you see, and very important is decreased synthesis of immunoglobulins. But you must know these information. That's all. So thank you for your attention and goodbye.
Thank you. Goodbye.